If you or a loved one has used a Philips machine for 6 months or longer and have experienced chronic asthma or other respiratory failure, strokes, heart failure, cancer, or possibly other symptoms, you should contact us immediately because you may qualify for compensation for your injuries. The poly-based polyurethane, acronym PE-PUR, sound abatement foam, which is used to reduce sound and vibration in these effective devices, may break down and potentially enter the device's air pathway. If this occurs, black debris from the foam released into the device's air pathway may be inhaled or swallowed by the person using the device. According to Philips analysis, the foam that breaks down into smaller than 8 micron units are unlikely to penetrate into the deep lung tissue. Small particles from the 1 to 3 micron units are capable of doing so. The smallest particle identified was 2.69 micron units. On June 14, 2021, Philips issued a recall notification for 18 different machines. On July 29, 2021, the FDA classified this recall as a Class 1, the most serious type of recall, and considered high risk. The REF number on the device can be used to confirm an affected model type using the FDA's classification web pages. Potential risks of this degraded foam can cause irritation to the skin, eyes, and respiratory tract. It is also alleged that exposure to this foam leads to headaches, asthma, affects organs such as kidneys and liver, and there are toxic, carcinogenic effects. To date, Philips has only received several complaints regarding black debris within the air pathways of the machines, as well as reports of headaches, irritation, coughing, chest pressure, and sinus infections. It is also alleged to lead to exposure to chemical emissions from the foam causing headaches, dizziness, irritation to the eyes, nose, skin, hypersensitivity, nausea, vomiting, and toxic and carcinogenic effects. Sleep apnea and other respiratory conditions are very common among veterans. In fact, sleep apnea is the most common service-connected respiratory condition in the VA benefit system. Many veterans diagnosed with sleep apnea are prescribed a CPAP, BiPAP, or ventilator machine to treat their symptoms. Because of this, over 300,000 veterans were notified by VA regarding this recall. Over 600,000 of these devices have been issued by VA alone. On September 1st, 2021, Philips said it would start replacing and repairing millions of respiratory devices manufactured between the years 2009 and April 26, 2021 in the United States and most of its other markets, which may take about a year. They will also be addressing potential health risks caused by the machines. Philips has also received authorization from the FDA to rework the affected DreamStation device by specifically replacing the current sound foam with a new material. Consult with your healthcare provider to determine next steps regarding suitable treatment for your condition. We are working with experts in the fight against the big companies responsible for your injuries. If you or a loved one has used a Philips machine for 6 months or longer, have experienced chronic asthma or respiratory failure, strokes, heart failure, cancer, you should contact us immediately because you may qualify for compensation for your injury.